Okay, thank you everyone for coming. We will be discussing Medicare Supplement Insurance Plans today, and our presenter today is Santonya Scott, and she is the Community Relations Specialist from Blue Cross Blue Shield of Illinois. And just a reminder, we are recording this presentation. We are streaming live to Facebook, and we will also be posting this to the ElderWorks YouTube channel. So before we begin, I'd just like to go over a little bit about ElderWorks. So we are a not-for-profit 501c3 organization, and our mission is to provide older adults, seniors, and their families with information, referrals, and guidance for senior living, home care, and support services. And the guidance that we provide will help seniors stay home well or transition successfully into a new senior housing opportunity. If you have any questions throughout the presentation, there is a Q&A button on your screen where you can ask questions, and Santonya will be addressing all the questions at the end, okay? And then after the webinar, we do have a short little survey for you. So we'd appreciate your feedback. That should pop up on your screen afterwards. Otherwise, you will receive a follow-up email with the link as well. Okay, so Santonya Scott joined Blue Cross and Blue Shield of Illinois in 2019. She started her career in the healthcare industry in 2016, where she found her passion working with the aging population. She holds a Bachelor of Arts degree and has a health producer license in Illinois, Montana, New Mexico, Oklahoma, and Texas. Santonya has experience educating the community about Medicare, Medicaid, and other government programs. She continues to pursue certifications and training to increase her knowledge about ongoing changes in the healthcare industry. As a Think Blue ambassador, Santonya has built and maintained strong relationships in the community by implementing Medicare community outreach programs, organizing events, and volunteering. Her mission is to serve Blue Cross and Blue Shield of Illinois members and communities and help them live better, healthier lives, one person at a time. So we are so lucky to have you here today. You can go ahead and get started. Thank you.
All right. Thank you for the introduction, Emily, and welcome everyone. Just in case you didn't catch my name, once again, my name is Santonya Scott, and I am a community outreach specialist with Blue Cross and Blue Shield. So today I am going to be talking about our Medicare Supplement Plans. So I'm going to start the presentation. And as Emily asked, if you can please hold all questions to the end, I definitely appreciate it. So let's get started. All right, Emily, can you see my screen?
Yes, we can see it.
Okay.
Thank you.
All right, I like to ask sometimes there's technical difficulty, so thank you. So let's get started, everyone. Once again, welcome. This is Live Your Blue Life, which is a Blue Cross Medicare Supplement Insurance Plan seminar. So it's your Blue at Blue Cross Blue Shield of Illinois. We helping you get the most out of your health plan with affordable quality coverage. Just a recap, my name is Santonya Scott, and I'm also a licensed agent of Blue Cross and Blue Shield of Illinois. So let's get started. What are Medicare Supplement Insurance Plans? Medicare Supplement Insurance Plans also is referred to as a Medigap plans, which is offered by private insurance companies and help supplement original Medicare Part A and B, which is your red, white, and blue card. Just a little history about Medigap. Was born out of a need to help Medicare eligible individuals with financial struggles cover the extra costs that Medicare did not cover. It fills gaps in original Medicare because, as you know, Medicare only covers 80%. Medigap plans assist with out-of-pocket gaps in Medicare coverage, such as co-payments and co-insurance costs that are not covered by original Medicare. So what Medicare doesn't cover, it does not cover your dental, your routine eye exams and eyewear, hearing aid and hearing tests, personal or custodial care, non-emergency transportation, healthcare outside the United States, a private duty nurse, and outpatient prescription drugs. So this is just a list of what a traditional Medicare does not cover. Are you eligible for a Medigap plan? So to be eligible for a Medigap, you can either be eligible based on your disability. If you're on a disability for 24 months or longer, you're eligible for Medicare. and also based on your age, which is 65. And enroll in Medicare Parts A and B, which is once again your red, white, and blue card. And just keep in mind, there is a guaranteed issue for Medicare beneficiaries 65 years of age or older, and Blue Cross Blue Shield offers guaranteed issues. So when is the best time to enroll? The best time to buy a Medigap plan is during the Medigap open enrollment period. This period is 6 months and it begins the first day of the month in which you're both 65 or older. So it is 3 months before your birthday and 3 months after. So during the open enrollment, you can sign up for any supplement plan and you are guaranteed coverage. Blue Cross Blue Shield will not turn you down because of pre-existing medical conditions. And after the open enrollment period ends, Medigap companies will require you to answer health questions on future applications and you may be turned down. So open enrollment is the best time to sign up for a Medigap plan. So now we're going to discuss the Medicare Supplement Insurance Plans basics. So Medigap plans are identified by the letters A through N. Each letter represents a different policy, different levels of benefits and costs. Plan C and high deductible F are not available if you're Medicare eligible on or after January 1st, 2020. But if you are already grandfathered in Plan F, you can currently stay in Plan F. So the reason I'm discontinuing these plans is to make all Medicare beneficiaries have some out-of-pocket costs when they use healthcare services. Also, by discontinuing these plans, the government hopes that people will be a little bit more choosy about seeking healthcare for minor ailments. But as I mentioned, it does not affect beneficiaries who've already enrolled in Plan C or F, eligible before January 1st of 2020. If you have had or a C or F or high deductible Plan F previously, you are still eligible to stay in those plans. A Medigap policy only covers one person. So if you and your spouse both want a Medigap coverage, you're required to buy a separate policy. So that means you will have to, you can have, your husband can have an N, you can have a Part G. So those have to be separate policies. All policies have the same basic benefits, but some plans offer additional benefits, allowing you to choose a policy that meets your individual needs. So the basic benefits: Medicare Part A is the hospital co-insurance and hospital costs up to an additional 365 days after Medicare benefits are used. Medicare Part B, which is your 20% co-insurance or co-payment. So that's what you have to pay with traditional Medicare. And then your blood for the first 3 pints. And then Part A, hospice, inpatient, respite care, co-insurance or co-payment. So now we're going to discuss our benefits overview. So here's a chart here of what traditional Medicare costs. So for Part A deductible, without any type of supplement, you would pay $1,484 per benefit period. For Part A hospital for 61 through 90 days, it's a total of $11,130 for 30 days. And for days 91 through 150, for a total of 60 days, is $44,520. For your Part A skilled nursing facility for 21 through 100 days, for a total of 80 days, this is $14,840. For your Part B annual deductible is $203. And for your Part medical insurance, generally you pay 20% of the Medicare approved amount after your yearly deductible is met. And then as far as excess charges, Medicare does not cover, you have to pay 100% of excess charges. So for total uncovered expenses that can be payable by you, and just keep in mind, this is based on an unusual and unique claim, could be a total of $7,490. For 2021, the Medicare Part A deductible is $1,484 for each benefit period. So for each time that you're in the hospital for that benefit period, it will be $1,484. If you wait 3 months after that time, you have to be hospitalized again, that benefit period will start all over again. So now I'm going to incorporate our plan, Supplement Plan G. And as you see here on the chart, there is quite significant in price. So you see that is benefits of having a supplement plan versus having traditional Medicare. So your Part A deductible, you will pay $0 if you had a Supplement Plan G. Your Part A hospital for 61 through 90 days and for days 91 through 150 are both at 0. Your Part A skilled nursing facility will be 0. Your Part B annual deductible will still stay the same at $203. Your Part B medical insurance is at 0, and your excess charges is 0. So your total uncovered expenses payable by you will be a total of $203. So having a supplement plan G versus a Medicare, traditional Medicare, you can save a whole lot of money. Also, for emergency care in foreign country, Medicare does not pay anything. But if you have a blue Medicare Supplement Plan G, 80% of eligible expenses up to a $50,000 lifetime. So what this means that you will only have to pay a $250 deductible, which is 20% in any amounts after the $50,000 lifetime maximum. So if you do go out of the country and you have a supplement plan, it will cover you in a foreign country. But if you do not have that supplement plan, if you just have traditional Medicare, you will have to pay out of pocket for all your medical expenses. So how Blue protects you. Medicare provides basic coverage, and then it does not pay all your medical expenses. As I mentioned, it only pays 80%. A simple accident or illness could bring unexpected medical bills, and a Blue Medicare Supplement Insurance Plan can help reduce the impact of unexpected expenses, as you've seen on the previous chart, that if you compare the cost for traditional Medicare with a supplement plan, you will have quite a reduction of unexpected expenses, sorry. So now I'm going to talk about Medicare Supplement Insurance Plans. So here is a chart for our plans A through N. So I'm going to go down each plan just to let you know what it covers. So Plan A covers your basic benefits, your 24/7 nurse line, and then your hearing benefits. Then Plan G, which is going to be the most comprehensive, it covers Med Select as an option. And I will go over what Medicare Select means shortly. And then your basic benefits, your skilled nursing co-insurance, Part A deductible, your Part B access, your foreign travel emergency care, your 24/7 nurse line, which is very useful these days during the pandemic, and then your hearing benefits. So we do have a new plan that just came out in 2021, which is our Plan G+. So this also has most comprehensive plan, but it also includes dental and hearing. So it has all of the benefits that traditional Plan G has, Supplement Plan G, but it also has dental and hearing, and it also has a Silver Sneakers program, which is great too. So if some people feel comfortable going to the gym, it's, of course, still social distancing and wearing a mask, there is a gym membership to any participating gym that accepts Silver Sneakers. So that's a great incentive of choosing a Plan G+ supplement plan. Then there's a high deductible Plan G, which is not covered under a Medicare Select option, but it does have the other benefits as the regular Plan G+. And then once again, it does include the Silver Sneakers, your dental, hearing, and then also your vision. Then we have a high deductible Plan G. And once again, that is not covered by your Medicare Select, but it is covered under your basic benefits, your skilled nursing co-insurance, your Part A deductible, Part B access, your foreign travel emergency care, 24/7 nurse line, and then your hearing benefits. Jumping over to K, L, and N, they're all covered under Medicare Select options. With K, the basic benefits out of 100%, Blue Cross Blue Shield covers 50. That means you are responsible for the other half, 50%. For your skilled nursing co-insurance, it's covered 50%. Your Part A deductible is also 50%. Your annual out-of-pocket is $6,220. It is covered by your 24/7 nurse line and then also your hearing benefits. Now, Plan L is going to be a little bit different from Plan K, as you see. So out of 100%, Blue Cross will cover 75%, leaving you with 25% to pay of any expenses that you may occur. Then also the skilled nursing co-insurance is 75%, your Part A deductible 75%. Your annual out-of-pocket is going to be different. It's going to go down to $3,110. And then you're covered by your 24/7 nurse line and then your hearing benefits. Now going to the last plan, which is Plan N, it is covered once again by the Medicare Select option. With the basic benefit, co-pays may apply, which I will go over that shortly as well. And then your skilled nursing co-insurance, your Part A deductible, your foreign travel emergency care, 24/7 nurse line, and then hearing benefits. So there's a full breakdown of all of our supplement plans. Just keep in mind if there's anything that you see on here that you may be interested in or getting more information, you can ask more questions at the end of the presentation, or feel free to put your email in the chat and I can email you some more additional information. Also, just a little tidbit of more information about these supplement plans. You are eligible for a household discount if two or at least two members reside in the same household. That household discount is currently at 7%. And if you are enrolled in a Blue Cross and Blue Shield of Illinois Medicare Supplement Insurance Plan effective on or after May 1st, 2019. So for the supplement insurance plans option, just keep in mind, network restrictions apply. So only certain hospitals are network providers under the policy. So check with your physician to see whether or not they have admitted privileges and are in the network, that your hospital is a network. If it's not, you may be required to pay for all expenses. You also must live within 30 miles of a participating Medicare Select hospital if eligible. And you cannot exceed any charges limitation established by Medicare programs or state laws. Also, plan covers Medicare necessary emergency care needed immediately because of an injury or illness. So this was, I explained to you about going out to a foreign country. So it will be covered, but then there will be a deductible of $250, which has a lifetime maximum benefit of $50,000. Also, the out-of-pocket annual limit may increase each year for inflation and also by your age. Plan F and G also have a high deductible option, which require first paying a plan's deductible of $2,370 before the plan begins to pay. Once that plan deductible is met, the plan pays 100%. So you have to pay that deductible first before Blue Cross Blue Shield will pay a full 100% of your covered services for that calendar year. High deductible plan G does not cover Medicare Part B deductible. However, a high deductible plan G does not count your payment of Medicare B deductible towards meeting the plan deductible. So that means your monthly payment does not go, your premium does not go towards your deductible. Plan K and L provide for different cost sharings for items and services than the other plans we offer. Once you reach the annual limit, the plan once again pays 100% of the Medicare co-payments, co-insurance, and your deductible for the rest of the calendar year. So this goes for each year that you're in your plan. The out-of-pocket annual limit does not include charges from your provider that exceed Medicare approved amounts. Called excess charges, you will be responsible for paying your excess charges. Plan N requires a co-payment of up to $20. As I mentioned on the chart, they do have co-pays for your office visits and a co-pay of up to $50 for ER. And then once again, for the Plan G, they do have dental, hearing, and vision. If you want an explanation of what those benefits are, once again, we can discuss that at the end of this presentation, or I can email that information over to you. So now we're going to go a little bit more detail about the Plan G. It offers, as I mentioned, it offers additional benefits and programs. It's covered by dental. It has a preventive dental benefits, vision, which is your annual routine, eye exam with dilation, and then also gives you an allowance for either your contacts or your glasses. You can choose one or the other. And it also has a hearing coverage, which is including your annual routine, and then discounts off your hearing aids. And also the great part of this plan is the Silver Sneakers program. So if you just want to go out and about, maybe join a aerobics class or a Zumba class or aquatics class, this would be a great feature to have with your supplement plan, was to have the free Silver Sneakers program, because the other supplement plans that we have do not come with this free Silver Sneakers. And then also the 24/7 nurse line access. So for the Plus G benefits, I'm going to go over the breakdown of your dental. It covers 2 cleanings and 2 x-rays a year. It covers 1 oral cancer screening, and then there's 0 cost when you go in for your dental exam. There will be no cost for you. Now, as far as your co-insurance for your extractions, it will cover 25%. Co-insurance for restorative and 1 filling per year is at 50%. So then with your vision, it was a 0 cost for your routine eye exams. And then you have 1 dilation that you can get once every 12 months. And then you can use the $130 annual allowance either towards your eyeglasses or your contacts. For your hearing coverage, there's no cost for your hearing exam. And then you do get a discounted hearing aids and including a rechargeable option. So these are the extra breakdown of the G Plus benefits if you decide to go with a G Plus plan for your additional dental, vision, and hearing benefits. So now I'm going to talk more about a high deductible option, Plan G, which is an annual deductible must be met before the plan pays anything. It includes a foreign travel emergency deductible. It has lower premium, so the high deductible, that you may have a high deductible, which means you will have a lower premium, and then your out-of-pocket costs may be higher. So now I'm going to talk a little bit more about the Medicare Select, which is a Med Select is a money saving option, and it is not an HMO. Offers the same benefits as our standard option, but costs less when Medicare hospitals are used for non-emergency care. So for example, with the Med Select to receive benefits for Part A deductible, you must use a participating Blue Cross Blue Shield of Illinois Med Select hospital, except in cases of emergency admission. If you do not use a Med Select hospital, you must pay the Part A deductible. So just once again, to qualify for Med Select, you must live in an approved service area, which is within 30 miles of a Med Select network hospital, but you can go to any urgent care or emergency for emergency purposes, any urgent care or any hospital. So now I'm going to talk a little bit more about Medigap Plans K and L. So plan pays for Plan K 50%. Blue Cross will cover 50. You will be responsible for the other 50. Your out-of-pocket limit is $6,220. Plan L at 100%, the plan pays $75. And then you will also be responsible for the 25. The out-of-pocket limit is $3,110 on Plan L. So Plan K is a good option if you prefer a lower premium, but still want a fair variety of coverage for a wide variety of services. But in general, Plan K offers a lower monthly premium than Plan L offers, and a higher co-insurance amount and a higher annual out-of-pocket limit. So Medicare Supplement Insurance Plan key points. So just keep in mind, you must have Medicare Parts A and B, which is your red, white, and blue card. You must continue to pay your Medicare Part B premium, which is currently at $148.50 a month, that you can be taken out of either your Social Security check or you can be billed. However, the option you want to choose to take out that Part B premium. And you must pay the insurance company a monthly premium for the Medicare Supplement Insurance policy of the one of your choice. And you just keep in mind, you cannot have a Medicare Advantage plan and a Medicare Supplement Insurance Plan at the same time. There are 2 different plans, so you can either have one or you can have the other. Also, enrolling in a Medicare Supplement Insurance Plan is optional. Each policy covers 1 person. A spouse can each pick a different plan to match their individual coverage needs. So as I mentioned earlier, you maybe want a G plus, and your spouse may be interested in a Plan L or a high deductible Plan G. You may be eligible for a household discount for 77%. Once again, if 2 members reside in the same household, which is a good discount if 2 people are residing. They don't have to be husband and wife. You can be sister and brothers as long as you are residing in the same household. And the Blue Cross Blue Shield of Illinois Medicare Supplement Plan, if it's effective on or after May 1st of 2019. So if you have 2 people that's been enrolled, that's in the same household, and the plan was effective on or after the May 1st, 2019, feel free to contact Blue Cross Blue Shield to see whether or not you'll be eligible for that 7% household discount. So you might ask yourself, why choose a Blue Medicare Supplement Insurance Plan? So there are benefits of having Blue. So original Medicare does not cover everything. As I mentioned, it covers 80%, which means you're responsible for the other 20. And you may have lower your out-of-pocket costs depending on the plan that you may choose, and you get more health insurance coverage. And then also you choose any doctor, you have the option to choose any doctor who accepts original Medicare. So every policy is backed by 80 years of experience. We have guaranteed acceptance for Illinois residents 65 and better with no health questions asked. You have the ability to switch between Blue Cross Blue Shield plans. You have the freedom to choose any doctor or any specialist who accepts Medicare, and there is guaranteed renewability regardless of changes in your health. Just keep in mind, just before I move forward, as far as the ability to switch in Blue Cross Blue Shield plans, of course, that's only during open annual enrollment, which is currently going on now, which is started October the 15th and goes through December the 7th. And then the open enrollment starts January 1st, and that continues to March 31st. So open enrollment is the time that if you change your plan during the annual enrollment, you have a chance to change either back to what you had before, or you can change a different plan. Coverage guaranteed to match your Medicare cost increases year after year. And 90% of our subscribers say they are satisfied. So that's a good record. Track record is almost 100%. And then we are nation's largest customer-owned health insurance company, and we are rated A Excellent and AM Best in company. So service begins the moment you can enroll. You can locate an authorized agent like myself, or you can feel free to go to our website, which is www.bcbsil.com/Medicare agents, or toll-free number 877-566-1277. And then we do have an online representative at getblueil.com/medsup. If anyone here, once again, wants some information, I am an authorized agent. We can discuss that at the end of the presentation, or you can put your information in chat and I can reach out to you. Also, tools to help you, we have Blue Access for Members, which is an online wellness tool and resources. So we have information about COVID updates, information about resources about anyone who may have Alzheimer's, dementia, or high blood pressure. We have a lot of resources. And then that website is www.bcbsil.com/member. And then as far as education, like the seminar you're on today, we have several other seminars. We have Medicare Advantage, we have Medicare Overview, and we do have those virtual, and we do have them out in the community. So feel free to go to either our bcbsil.com/Medicare/seminars or Think Blue IL. And you can see more seminars that may be holding face-to-face if you feel comfortable coming out somewhere where you live. And then also, since we are back in the community doing health fairs and community events, you can go to that website to see what type of community events that we have upcoming for the next couple of months of the year. And then also, we do have some health fairs that's coming up as well. So help is always available. We have Medicare resources, which is medicare.gov. Social Security, which is ssa.gov. I know I talked to a few people recently, and they're still saying that the Social Security office is still not open. I'm not sure if that's everywhere, or if they are, they're only probably in there for a certain amount of hours. So the best way, my understanding is to get in contact with them is trying to reach them through a telephone number. I know how much luck you're gonna have doing that, but you can try, or going to medicare.gov. And then for Social Security, they have a toll-free number as well, 1-800-772-1213. Just additional information, we are not connected with or endorsed by the US government or federal Medicare program. Medicare Supplement Insurance Plans are offered by Blue Cross and Blue Shield Illinois, which is a division of Healthcare Service Corporation and a mutual legal reserve company and an independent licensee of Blue Cross and Blue Shield Association. Also, Blue Cross Blue Shield of Illinois complies with applicable federal civil rights laws, and does not discriminate on the basis of race, color, national origin, age, disability, or sex, and provides free aids and services to people with disability to communicate effectively with us, and provides free language services to people whose primary language is not English. Just a little more additional information, bear with me. If you believe that Blue Cross Blue Shield Illinois has failed to provide these services or discriminate in another way on the basis of race, color, national origin, age, disability, or sex, you can file a grievance with our Civil Rights Coordinator office. Their email address is civil rights coordinator at hcsc.net. And just keep in mind, if your primary language is not English, we do have various interpreters that can speak different languages of your choice to communicate effectively about the questions you may have about Blue Cross Blue Shield. And that concludes our Medicare Supplement seminar, Live Your Blue Life. So now Emily is going to unmute you guys, and if you have any questions, we can discuss at this time. Thank you.
Thanks. So if anybody wants to unmute, please just let us know in chat and I can unmute you individually. And I don't see any questions in the Q&A. I did want to let everyone know that Santonya will be back. She's doing the same presentation on Thursday this week at 10. And then she'll be back in November, on November 11th at 10 a.m. to do a Medicare Advantage Plans presentation. So
yes. So if no one has any questions, like I said, if there's anything that, I know this is the time of year that you get an overwhelming mail that's, saying, this is time to change, which can get confusing to people thinking they have to change. My famous line is, if it's not broke, don't fix it. So if you're happy with what you have currently, just know that you don't have to change your current plan. You can stay where you're the plan that you're in. You're going to see stuff on TV as well. So I'm just here as a community outreach, just wanted to educate people, just to let you know what your options are with Blue Cross Blue Shield, so you can have a educated decision on whether or not you may want to change, or you may be transitioning to 65 for the first time and still just, are just shopping around and just not sure what plan you may want to choose at this time. A lot of people do sometimes gear towards Blue Cross Blue Shield because it's a brand name that most people do have, insurance company that most people do have over the years as being with their employer. Blue Cross Blue Shield is the most common. So some people, go into that plan with Medicare because that's something they've always had previously. So I think we have a question.
we do have a question. It says, I have
right.
Plan F. How does this compare with the other plans?
So as I was mentioning, Plan G is going to be the most comprehensive. So that's going to be comparable to Plan F. Was that the answer you was looking for? I'm sorry.
Let us know in the chat if that answered your question or if you have any other questions.
So yes, the G and the G plus is going to be comparable to the F. The other plans like L, M, and N, as you saw on the presentation, they're going to have either some type of copay or some out-of-pocket costs. So with the Plan G or G plus, it's going to be more comparable to the Plan F. It's going to be the most comprehensive.
Okay, any other questions from anybody? Oh, there we go. Okay, can you explain guaranteed issue? If I change plans at Blue Cross Blue Shield in the future, will there be health questions?
So no. So as of right now, things are always subject to change, but currently with Blue Cross Blue Shield, there is a guarantee issue. So that means that there is no questions asked. So once you go into transition, either from, let's say you're in Atlanta and you're coming to a Blue Cross Blue Shield plan, that it is going to be no questions asked and you will be able to enroll into a health plan of your choice.
Okay, thank you. Any other questions? Okay, when do rates change for the plans?
So the rate changes each year. So the rate changes come in around April. So that's when you'll know what the rates are going to be based on the inflation, and then also based on the age you are, that each year the rates come out.
Okay, anything else from anyone? Oh, if I already have a plan, can I change any time during the year?
So the answer to that would be no. You would have to change during, right now would be the time to change during annual enrollment. So it started October the 15th, and you have until December 7th to make a change. Now, if you're transitioning into turning 65, that triggers an enrollment for you, initial enrollment, sorry, for you to enroll into a Medicare, not Blue Cross, but any Medicare Medigap plan during that time, which is 3 months or 3 months after your birthday.
Okay, anything else, anyone? And feel free to share this recording with your friends or family or anyone you think might benefit from this. So it'll be on YouTube, Facebook, and
Yes,
we do have we have a short little survey that'll pop up on your screen. We'd appreciate any feedback you have for us. Okay.
And just keep in mind, if you guys are interested in coming to some more seminars, like I said, we do in the Medicare Advantage, and I will be doing some more with ElderWorks, but if you want to see more of a face-to-face seminar and have more of a hands-on, well, not hands-on, I don't want to say that, can't say too much of that during the pandemic. But you get what I'm saying. You can go face-to-face and see what's in your area. We, as I have to think Blue Team, is 5 of us, so we're across Illinois, Cook County, Will County, King County. I think I said Will County. So we're all over. So if we're somewhere in the area that's not close to you, just feel free, like I said, to go on that thing. It's called thinkblueil.com, and they'll have a whole outline of all of our seminars, all of our health fairs that we're going to be doing for the next couple of months, and community care fairs that we do have with different organizations where we give out free turkeys and things of that nature. So we have a lot of stuff going on in the community outside of just doing enrolling people, of course, and just educating. We give back to the community as well.
That's great. Okay. Okay, I think that's all the questions we have. Thank you so much for coming on today. Thank you, Santonya.
Yes, thank you for having me, and thank you for everyone for joining us. Hopefully you were able to walk away with a little more information about our supplement plans that you didn't know before. So yeah, just feel free, like she said, I will be back on Thursday for another supplement plan. So if it's some friends or families that you feel they may be interested in joining us, then feel free to share the information.
Okay, thanks everyone.
Thank you. Have a great day.